you are the CEO for the Common Ground Health of the 9 counties.
That's correct. Common Ground Health, we're an independent 501c3, governed with a board of directors, and we see it as our mission to bring focus to the region's health issues. And we bring focus through our research data analytic, through our community engagement, and through the collaborative partnerships in which we engage.
Okay, so you guys just released a report. It's a long report. There's a lot to it. I would love it if you could just break down for me sort of how that report came to be, how you got it together, and then what are the big takeaways from it? And what does it mean to people living here in the Finger Lakes?
Sure. What we just released is our comprehensive regional community health assessment, the CHA. And this is an incredible collection of health data that has been produced by our agency and by the public health departments in Chemung, Livingston, Monroe, Ontario, Schuyler, Seneca, Steuben, Wayne, and Yates. And this is, I really consider it to be the Bible. It allows us at a glance look at what is going on with regard to the health of the folks who live in the Finger Lakes region. And what is really exciting is that this document has a place in state regulation and statute, that these county level health assessments led by each public health department is really what informs each county's health improvement plan. And so this thing connects to county government, county policy, and to state spending. And it's rooted in the facts on the ground in each of the counties that make up our region.
How do you go about getting something like this together, though?
First of all, the health departments do incredible work. Their staffs, their outreach to the community, the data that flows from the state to them, that forms the basis. But we, as the regional health planning entity, are able to wrap other data around it. Data with regard to housing, with regard to income, with regard to education. And because we have been at this for so long, we can really provide decades worth of data to be able to observe trends and changes in the community. And I think that you're right. When all of that stuff comes together in one very big book, instead of 9 separate ones, it gives you the chance to see who we are as a region and how, if we can wisely continue to work together, we can address problems that impact all of us in a way that's better than if we tried to do it alone.
All right, so tell me about this most recent comprehensive regional community health assessment. What did we find out? What are the big takeaways?
I would say that the big three, in my view, is first of all, how the region is growing older. And as I look in the mirror each day, I can absolutely see how that truth of the region is truth in my own life. The number of older adults is going to increase over the course of the next 5 years, even as our region's population overall is shrinking. And I think that is going to have profound implications on our workforce and our healthcare and our human services systems. But I think it also offers us an incredible opportunity. That what we do have is a real wealth of older adults with a great deal of lived experience who are in an economy that is on the move. We might very well find ourselves able to argue that we're a place that people should be thinking about coming to start their careers or start their families. We're a great place to raise a family, and by golly, we have lots of folks who will be eager as older adults to have more children in their lives.
Absolutely. So that was one of the big takeaways. What's the next one?
I say mental health, and I say thirdly, the rates of opioid overdose death. So it is the aging of our population, mental and emotional health, and the substance abuse, behavioral health issues expressed by the opioid crisis.
So now what do we know about what's going on with mental health and how do we know?
What we know is that the data shows that there is a rise in the number of people who are reporting and who are seeking help for depression. And I think that that is a very good sign. I am hopeful that it continues to be a reflection of how easier we are making it for people to have conversations within themselves, with others in their friends and family circle about the importance of mental health and the need to seek mental health supports when necessary. I am hoping that it is a sign of our getting access equity for mental health services, but I am afraid that that increase in the demand and the need for mental health and emotional health supports is occurring at the very time where the workforce is the most stretched that we've seen, and the need for folks who can practice transculturally or across languages is greater than ever. So it is a trend that brings some signs of at least hopefulness in terms of destigmatizing mental and emotional health, but certainly it brings challenges in how are we going to meet this increasing need.
But
And
yeah, I
then
mean,
I'm sorry,
no, I mean, that's a good point.
yeah. And with regard to the doubling of admissions into state certified treatment programs for opioid addiction, it is very clear that we have a number of things that simply are sad indicators of the mental and emotional health needs of the region and of the crippling power of addiction across a number of different chemical dependencies that requires us to continue to redouble our efforts, and to the extent that we continue to see issues of addiction among older adults, feelings of isolation and alienation among older adults, the more we understand that these three troubling trends really have the opportunity to be addressed in a manner that benefits us on all three fronts, or they have the ability to be anchors that weigh us down in three different ways.
And so what do you mean by that, that we can address all three? Are you saying that they're connected in a sense that like I mean, they're connected? That's what you're
Yes,
saying?
Rebecca, it's the beautiful thing of the fact that neither our bodies, minds, or lives are split neatly along these different silos. When we can understand how they are interconnected, it really allows us the robust ability to actually attack the root causes instead of just simply whacking away at the symptoms.
So what do you think can be done for, aging population, mental health, and did you say that admissions into state programs have doubled? Is that what you
Yes,
said?
ma'am.
Just
Yes.
it's since when? And
Let me give you that time window. 2014 to 2018.
have doubled
I'm sorry, 2010 to 2019. I apologize. 2010 to 2019, admissions in the region to state certified treatment programs doubled.
from 2010 to 2019?
Correct.
Huh. Interesting. And this is for programs to address opioid addiction specifically or just drug
Correct.
addiction?
Opioid addiction specifically.
Oh, wow. I didn't even know there was opioid specific state.
Certifications, yes. There's the state, when they certify treatment programs, what they're really looking for is the expertise and the capacity to deal with to follow the specific clinical guideline laid out for each type of treatment service.
So Wade, what's the plan moving forward for Common Ground Health? Like, what do you think needs to change? What can be done, and what I guess advice are you giving?
I think that the opportunity before us is to recognize that just as our clinical approaches need to become more holistic, we also need to better connect the clinical approach with the community approach. And we need to make sure that not only are the clinical and community supports in sync. For me, learning how to manage my diabetes, I was offered the opportunity to attend a weekly church-based support group for other people who were newly diagnosed with diabetes. That was something that was accessible to me, free of charge, just as a part of my medical care. It put me in a community of people who had shared values and shared language that really allowed me to make the behavior and lifestyle modifications that have done so much to support my health. We need to recognize patients need help. That older adult living alone could remain at home safely if we had the right community supports. And that's what our county offices for the aging strive to do, with very limited support from the state, from and so my hope is that if we as a region can better model how community and clinical partnerships come together to support people, to support the whole of people, not just slices, we come to understand how these community supports are wise investments. They're the ounces of prevention that will save us all pounds of cure.
What are some other takeaways from the report that maybe we might be interesting that we didn't talk about?
I would say the increase in the use of e-cigarettes. I am not actively parenting. My children were not teenagers during the e-cigarette vaping stage of things. The fact that there is an increase in the use of such products strikes my attention. And is an area in which I would like to find out more and learn more from our county health department partners. What might we be doing? What might we be asking the state to do? And I'd also note that this does not include survey data that we're in the field on right now. With our regional health survey, Rebecca. So there will be a follow-up to this story because that regional health survey gives us the chance to get some qualitative data. We ask people open-ended questions, and so it gives us the voice of the people. And I'm interested in knowing how some of the things here in the CHA are given. I see the CHA's the play-by-play. Let's see what the color commentary gives us that will deepen our understanding. And hopefully we'll be able to get that out in a manner that'll be interesting to you to want to come back and have another conversation about.
When is the regional health survey coming out?
They'll probably be out later, late spring, early summer.
Data is in late spring. And what will that look like?
What that will do, I hope, is it will give us the qualitative information and some more quantitative indicators that fill in some of the blanks of what the CHA is telling us. So when we hear about older adults and the trend of aging, hopefully we'll get some quotes that let us know in a scientifically valid way, what are people thinking about aging in their home? Are they thinking of relocating? What are their concerns? What will people share with us? There's no way to tell, but I will tell you the last time we did this in the summer of 2018, what people said very clearly is mental and emotional health is important. If you live in a household with low income, if you are challenged with the safety of your community, urban, rural, or suburban, and if transportation is a barrier. And I think it was very important that we were able to surface through the voice of the people what this current data is now beginning to tell us, that there's a growing need and a desire for mental and emotional health supports. So I'm not quite sure what we'll see, but I know what we will see will be information that will help us bring focus to these three issues in our region.